A very warm welcome on another very chilly night to World Horse Welfare's Wednesday webinar. You're joining us by Zoom. We're just going to mark time slightly as we wait for those to join us by Facebook Live. And during the course of this evening, we've got a couple of poll questions for you. So as Zoom followers, you'll be able to sort of get involved in that. So please do get involved in a couple of poll questions we've got. This is the 11th webinar we've done, and we've covered a whole series of different topics, from weight management to disease control to pasture management to responsible worming. And tonight I'm very delighted that we've got Dr. Sue Dyson from independent expert who's had a long lifetime of experience at the Animal Health Trust, and also our very own Tony Tyler. So a good evening to everyone joining us on Facebook Live to what is our 11th Wednesday webinar tonight, which is got two areas we're going to look at. Firstly, around identifying pain in ridden horses, and secondly around rider weight, or appropriate weights for riders to their horses. And I'm delighted, as just mentioned, we've got Dr. Sue Dyson with us, and also our own Tony Tyler, Deputy Chief Executive from World Horse Welfare. Tonight, slightly different format. We've got one presentation from Sue, which is going to go on for about 40 minutes. And then Tony's going to join us and we're going to have a Q&A. So we have got lots of interest in tonight's webinar, which is wonderful. So if you could get involved, we'd love it. If you're on Facebook, please put your questions on the comments section. If you're on Zoom, if I could ask you to, if you've got questions, put them on the Q&A function. By all means, use the chat function to chat between panelists and other people joining us by Zoom. But if you can create the questions in the Q&A function, and either way you are doing it, if you can please keep your questions nice and concise, and then we'll be able to get through as many as we can. If you're also joining us by Facebook, then please do share the video. We've been running these webinars since the summer, and we're going to carry on into the new year. So if you enjoy them, then please let your friends and colleagues know that we do record them all, and they're all put on up our YouTube channel. But also, we're looking for always future topics to focus in on. So if you've got something that you would like us to cover in future webinars, then please email us at education@worldhorsewelfare.org. Now, this is the moment where I share my screen, which is always, if you're joined us on previous occasions, always a seamless affair. Which are done extremely professionally, says he. There we go. So what we're going to do is going to kick off with a poll question. There is no right and wrong answer here. We're not testing you at all, but we just want to get a feel for who's joining us tonight. So are you confident in recognising when a horse might be in pain whilst being ridden? And we've got a series of options there, from yes, I am confident, no, I'm not confident, or no, not at all. And so whilst you're answering that question, and I'm sorry, if you're joining us by Facebook Live, you won't be able to answer the question or put an answer in, but you can if you are on Zoom. And so whilst you're doing that, I'm just going to hopefully tell you a little bit about World Horse Welfare, which is a charity that was founded in 1927, and at the heart of what World Horse Welfare is all about is to support the horse-human partnership. And obviously we know that so well through the use of horses in sport, where we support the responsible use of horses by advising regulators, including the FEI and the British Horse Racing Authority. And at the heart of what charity does, it's all around caring, around researching, around campaigning, but also around education. And that's what tonight is all about, and these Wednesday webinars are all about. And as I mentioned, we're focusing tonight on two topics: identifying pain in ridden horses, and also rider weight and the appropriate rider weight for our horses. Because we all know at World Horse Welfare that, you know, it's, as owners, it's a real struggle sometimes to juggle all the various priorities and always to know what is best for our horses. And that's why we focus these webinars around trying to provide some practical help, giving you the information and then providing some practical help. And that's why it's brilliant that we've got Sue with us tonight, who's got a lifetime of experience in equine health and welfare, but also we've got Tony as well, who can bring World Horse Welfare's perspective on these issues as well. So hopefully, having said all that, the magic will work, and Basil will now be able to provide us with an answer to our poll question, and we've got a really good wide spread there. So just under a third saying yes, I am confident I could recognise not only obvious signs but also subtle signs, down to, and of course then about a quarter of you saying I'm not sure, it can be difficult to know whether the horse is in pain or just having an off day. So I think that's a really good start. So thank you for getting involved in that. Sue might well pick up on that during her presentation, or indeed when we get through to the discussion. So now it gives me great pleasure to introduce Sue, if I can move on to the next slide, who went to a wonderful university, the University of Cambridge, and having completed an internship over in the US, had a few years, the Animal Health Trust. Obviously, you look at me and you recognise I'm very young. And that's because I went in my early years, saw experience with Sue at the Animal Health Trust, and that support and that guidance has been with me ever since. So I shudder to think how many students and how many vets Sue has supported in her lifetime, but that it is many, 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 and the profession is all the richer for it. She, as I said, she was at the Animal Health Trust until 2019, and has been working as an independent consultant since then. She's had a close relationship with the World Horse Welfare. I view her as a great friend of the charity and personally, and so I'm delighted that Sue's able to join us this evening. So Sue, thank you very much, and over to you.
Well, thank you very much for those words of welcome. I'm going to be addressing some fairly controversial subjects tonight. In terms of recognising pain in ridden horses. I was quite stunned by the results of the poll, and I think the audience will understand why when I present the background to why we developed the ridden horse pain ethogram. So, first of all, let's ask the question, what is an ethogram? An ethogram is a series of behaviours with specific definitions. For example, as we see in the horse on the right, the ears back behind a vertical position for 5 seconds or more. Repeated exposure of the sclera, the white of the eye. The mouth being open with separation of the teeth for 10 seconds or more. And the tongue being out or moving in and out repeatedly. So why was the ridden horse pain ethogram developed? There were a number of reasons. Lameness may not be apparent in hand or on the lunge, but only evident ridden. And lameness may be manifest as a change in performance rather than overt lameness. I believe that recognition of aspects of behaviour can highlight the likely presence of pain, but I also believe from evidence that owners, and also I'm sad to say some veterinarians, are not very good at recognising the presence of lameness. In a study of 57 sports horses, which were in normal work, and these were professionally produced dressage and show jumping horses, assumed to be non-lame, 47% showed lameness either in hand, on the lunge, or ridden, and 12% of these were only lame when ridden. In a more recent study, based in the United Kingdom, we had a convenient sample of 148 amateur and professionally owned horses believed by their owners to be working comfortably. These horses were assessed in hand and ridden. 28% were lame in hand, and 62% were lame when ridden. The difference in lameness when ridden versus in hand was statistically significantly different. However, the presence or absence of lameness in hand versus ridden was somewhat unpredictable. 13 horses were lame in hand, but not when ridden, whereas 63 horses were lame when ridden, but not when assessed in hand. When evaluated ridden, the horses were assessed in both walk, trot, and canter. 60% of the horses showed gait abnormalities in canter, such as lack of a suspension phase or close spatial and temporal separation of the hind limbs. I have been very conscious for many years during my clinical work that owners were poor at recognizing the signs of lameness. And many ridden horse problems were attributed to training or the rider, or that's just a difficult horse. I had also observed during my lameness investigations that many behaviours that I saw in ridden horses disappeared when I removed the lameness using nerve blocks. I therefore felt that there was a strong relationship between ridden horse behaviour and the presence of musculoskeletal pain. I was aware that owners were clearly bad at recognising lameness, and therefore it might be helpful if we could demonstrate scientifically that behaviour could be related to pain, and maybe owners could be better at recognising behaviour. And therefore, we set about the development of an ethogram to determine the presence or absence of pain in the ridden horse. And we did this initially by comparing a large number of video recordings of lame and non-lame horses. And we started with 117 behavioural features. We then compared the presence or absence of these behavioural features in 13 non-lame horses and 24 lame horses. And by this comparison, we were able to determine which of these 117 behaviours were most commonly associated with pain. We identified 24 behaviours, the majority of which were 10 times more likely or more to be seen in a lame horse compared with a non-lame horse. And these 24 behaviours I'm going to describe to you. The first being the ears rotated back behind a vertical position for 5 seconds or more. The eyelids being closed or half closed for between 2 and 5 seconds. The sclera, or the white of the eye, being exposed on a repeated basis. The horse exhibiting an intense stare or glazed expression for 5 seconds or more. The mouth being open or opening and shutting repeatedly with separation of the teeth for at least 10 seconds. The tongue being exposed, either protruding or hanging out, or moving in and out on a repeated basis. The bit being pulled through the mouth on one side, either to the left or to the right, reflecting uneven rein tension. There were body markers. These included repeated up and down changes of head position, not in rhythm with the trot, or the head being tilted on a repeated basis. The front of the head being in front of the vertical position, more than 30 degrees for at least 10 seconds, or the head being behind the vertical position, more than 10 degrees for at least 10 seconds. The head position being changed on an intermittent or regular basis from side to side. The tail either being clamped tightly to the horse's buttocks or held crookedly to one side. And repeated tail swishing movements, either up and down, side to side, or in circular movements, either during walk, trot, or canter, or during transitions. And then there were gait markers. A rushed gait being defined as a frequency of trot steps of more than 40 per 15 seconds, or an irregular rhythm in trot or canter, repeated changes of speed in trot or canter, or the gait being too slow with a frequency of trot steps less than 35 per 15 seconds, this often appearing as a passage-like trot. The hind limbs not following the tracks of the forelimbs, but deviating either to the left or to the right. Therefore, the horse moving on 3 tracks, as we see in the image on the right, when the left hind limb is being placed on an inner track compared to the left forelimb. The horse repeatedly striking off on the wrong leg, or repeatedly changing legs either in front or behind, becoming disunited. Or the horse showing spontaneous changes of gait, for example, breaking from canter to trot or from trot to canter. The final 5 behaviours were the horse either stumbling in front or behind, or exhibiting a repeated bilateral hind limb toe drag. The horse spontaneously changing in direction against the rider's cues or directions, or spooking. The horse being reluctant to move forwards freely, having to be either kicked or verbally encouraged, or stopping spontaneously. And the horse either rearing or bucking, as we see in the image on the right. When we compared lame and non-lame horses, we found a significant difference in the ridden horse behaviour ethogram scores. The non-lame horses had a maximum occurrence of 6 of the 24 behaviours, and the most frequent score and the average score were 2 out of 24. Whereas the lame horses had a maximum occurrence score of 14 of the 24 behaviours, with the most frequent and the average scores being 9 out of 24. So here we see on the left, the horse swishing its tail, in the middle, the horse tilting its head and the right ear being back, and on the far right, both ears being back, the horse having an intense stare or glazed expression, and the bit being pulled through to the left and the mouth open. I can't tell from this photograph if the teeth are separated. The presence of 8 or more behavioural markers were likely to reflect the presence of musculoskeletal pain, although a small number of lame horses scored less than 8. In this graph, we have the ridden horse pain ethogram score on the vertical axis, and on the horizontal axis, to the left, we have the lame horses, and to the right, we have the sound horses. The dark blue boxes reflect the total score, the green boxes reflect the facial scores, the brown boxes represent the body scores, and the white boxes represent the gait scores. And we can see all of the scores are higher for the lame horses compared with the non-lame horses. And most specifically, the lame horses mostly had a score of more than 8. The blue hashed line represents that cutoff of 8, whereas the majority of the non-lame horses scored substantially less than 8. We then went on to compare a group of horses which were lame horses before and after resolution of lameness by the use of nerve blocks. And we observed that there was a significant reduction in the ridden horse pain ethogram scores after the resolution of lameness. So in the pictures on the right, we can see the horse before diagnostic analgesia with the rider in the pink t-shirt. The ears are back. The horse has an intense stare. Its tail is swishing. Whereas on the far right, with the rider now in the blue sweater, the ears are forward. The front of the head is in a vertical position, whereas previously it had been in front of the vertical, and the horse has got a more open expression in its eye, and the tail is swinging nicely. This second study provided further evidence that the presence of 8 or more behaviours was likely to reflect the presence of musculoskeletal pain. In a further study, we evaluated the ability of 10 non-trained individuals of various professional backgrounds to utilize the ethogram and compare their performance with an expert, viewing the videos of 21 horses before and after diagnostic analgesia to eliminate their lameness. And this study showed that the non-trained assessors were able to differentiate between the horses before and after diagnostic analgesia. Our next question was, can veterinarians reliably apply the whole horse ridden ethogram to differentiate between non-lame and lame horses based on live horse assessment of behaviour? We had 10 volunteer veterinarians who underwent preliminary training. They then observed 20 volunteer horse rider combinations performing a purpose-designed dressage type test of 8.5 minutes duration. The trained veterinarians were able, based on use of the ridden horse pain ethogram alone, to differentiate between those horses which were lame and those horses which were non-lame. Of the 20 horse rider combinations, which were assumed to be non-lame horses, 4 alone were non-lame horses. 16 of the horses showed either low-grade lameness or gait abnormalities in canter. We also were able to assess the ability of the trained assessor, the expert, to compare their performance using real-time assessment of horses versus application of the ethogram to video recordings. And here we have a summary of the results. The ridden horse pain ethogram score is on the vertical axis. On the horizontal axis, we have the expert's assessment in real time on the left, the expert's assessment of the video recordings in the middle, and the trained veterinarians on the right-hand side. The green boxes represent the lame horses, and the blue boxes represent the non-lame horses. And we can see there's a good similarity in the scores of the expert for both the real-time and the video assessments, and between the expert and the volunteer veterinarians. And this applies both to the lame horses and to the non-lame horses. For the non-lame horses, the trained veterinarian scores were slightly higher than the experts. And for the lame horses, there was slightly greater variability for the volunteer veterinarian scores versus the experts. But basically, there was very good agreement. We then went on to apply the ridden horse pain ethogram to horses out in the field. So we had a convenient sample of 60 sports horses and riding school horses in regular work, and once again assumed by their owners to be working comfortably. They performed the same 8.5 minutes duration dressage type test at preliminary level, plus the addition of 10-meter diameter circles to the left and to the right in rising trot. Of these 60 horses, 73% of the horses were lame. However, that lameness was of a relatively low grade, being grade 2 out of 8 maximum on one or more limbs. 47% of these 60 horses had gait abnormalities in canter. The ridden horse pain ethogram scores ranged between 3 and 16 out of 24, with a median, or the most common score, being 9. And there was a statistically positive association between the ridden horse pain ethogram scores and the presence of lameness. So the higher the ridden horse pain ethogram scores, the more likely it was that the horses were lame horses or had gait abnormalities in canter. So these series of studies indicate to me that the ridden horse pain ethogram is a potentially very powerful tool to differentiate between horses experiencing musculoskeletal pain when ridden and those which are pain-free. So the presence of 8 or more behaviours is highly likely to reflect the presence of musculoskeletal pain. However, some lame horses score less than 8 behaviours, and that may be because the lameness is very mild or they're particularly stoical individuals. So how do we use the ridden horse pain ethogram? I think it is useful to provide owner education of the presence or the absence of a problem, despite the fact that owners are often unable to recognise lameness. By looking at behaviour, you should be able to identify that your horse may have a pain-related problem. It helps us to identify the presence of a problem that may be subclinical, but still contributing to poor performance. By early recognition of the presence of musculoskeletal pain and investigation of that problem, I believe that we can improve the performance of some of these horses and therefore improve their welfare as well. I routinely use the ridden horse pain ethogram at pre-purchase examinations as an additional tool in my work as a detective to determine whether or not the horse is suitable for purchase for the purposes for which it is required. I think it is useful when assessing saddle fit, because saddle fit, an ill-fitting saddle, we know can contribute to pain and can make the ridden horse pain ethogram score be increased. I also use the ridden horse pain ethogram when I'm assessing the responses to nerve blocks in a lame horse. If I think I've abolished the lameness, but the ridden horse pain ethogram score remains at 8 or more, I know I must have missed something contributing to pain overall, and I have to investigate further. So to me, it's a hugely valuable tool. So my take-home messages from this part of the presentation are, even if a horse appears non-lame in hand, it may be lame when ridden, and this may be manifest by its behaviour. Its behaviour is an indicator that something is not right. And just because a horse can jump well doesn't mean that it's necessarily clinically normal. If it's not performing satisfactorily on the flat, that generally reflects the presence of a problem. I believe that problems which have historically been labelled as training related, rider related, or behavioural, or that is just how the horse has always gone, are usually pain induced. So, as we see in the images on the bottom, resistances to go forward, spookiness and tension, tail swishing, head tilt, are all potentially signs of underlying discomfort. A difficult horse may show one behavioural sign, such as rearing. But most so-called naughty horses show many behavioural signs consistent with the presence of underlying pain. So this grey horse is spooky. It swishes its tail, it's put its head, front of its head in front of the vertical position or behind the vertical position, or it rears and opens its mouth, shows an intense stare, exposure of the sclera, all signs in combination that reflects the presence of underlying musculoskeletal pain. I strongly believe that education of all involved in the equine industry is needed to recognize that these behaviors are not normal behaviors for horses. They reflect underlying musculoskeletal pain. And if we recognize this and investigated these horses, their performance could be improved. They would be more of a pleasure to ride. And importantly, the horse's welfare could also be improved. The next phase of my talk is to describe the influence of rider size and equine performance, a particularly emotive issue. As a basic fundamental principle, I believe that for optimal weight and force distribution, the rider should sit in the middle of the saddle to enable them to be in balance with the horse and as close to the horse's center of gravity as possible. We performed a pilot study which assessed the influence of rider size on horse performance. We had 4 riders of similar ability but differing in size, who each rode 6 non-lame horses in a crossover design in a randomized order. So we had a lightweight rider whose body weight was between 10 and 12% of the horse's body weight, a moderate weight rider whose body weight was more than 12 and up to 15% of the horse's body weight, a heavy rider who was more than 15 and up to 18% of the horse's body weight, and a very heavy rider who was more than 20% of the horse's body weight. And for each test, the riders rode a purpose-designed dressage test of 30 minutes duration, involving simple walk, trot, and canter, and transitions. We had reasons for premature abandonment of the test, and these were either the development of transient lameness of grade 2 out of 8, or the demonstration of 10 or more of the behavioral markers of the ridden horse pain ethogram. And all the tests for the heavy and the very heavy riders were abandoned, the majority because of transient lameness or the demonstration of 10 or more behavioral markers. The lameness was transient. These horses were assessed in trotting in hand within 30 to 40 minutes of completion of the ridden exercise, and they appeared non-lame at that time and were subsequently ridden either by the light or the moderate riders again and showed no evidence of lameness. The ridden horse pain ethogram was applied retrospectively to video recordings of the trot phases of the test. And we found that the ridden horse pain ethograms scores were positively correlated with rider weight. So there were a higher number of behaviours shown for the heavier riders compared with the lighter riders. So in this graph, we can see the total score of the ridden horse pain ethogram on the vertical axis, and the 4 riders, the lightweight, moderate, heavy, and very heavy, on the horizontal axis. We can see that the scores are higher for the for the heavy and very heavy riders compared with the lighter weight riders. But note that it was only for the heavy rider that the score ever exceeded a threshold of 8. We determined that this failure to complete the test, either due to transient lameness or the display of 10 or more behaviours of the ridden horse pain ethogram, was an influence of body weight or size rather than the body mass index. The body mass index is a proportion of the height of the rider's weight divided by the height squared. Overweight is defined as being between 25 and 29.9. And we can see that our moderate weight rider had a body mass index of 28. So she was classified as overweight. So both the moderate and the heavy riders were overweight. The very heavy rider was obese. However, when we compare the results for the moderate and the heavy riders, all the tests were abandoned for the heavy rider, but only 1 of 12 tests was abandoned for the rider of moderate weight. I think it is critical to think about this study, not only with respect to weight, but also rider size, because the normal rider of horse 2 was a very similar body weight, 92 kilograms, compared with our heavy rider, who was 91 kilograms. However, the normal rider of horse 2, depicted in the image on the left, was considerably shorter, being only 157 centimeters, compared with rider H, who was 185.5 centimeters. The horses were ridden in their normal saddles, mimicking, for example, what happens when an adult rider warms up a pony in preparation for a show class. As a result of this, the heavy rider in the horse's saddle for horse 2 finished up sitting on the back of the saddle rather than in the middle of the saddle. The normal rider for horse 2 was able to sit in the middle of the saddle, and the horse shows no evidence of discomfort or lameness when ridden by her. So I believe that there is a huge influence of rider height on their potential position in the saddle, which alters their weight distribution and their center of gravity, and their center of gravity relative to the horse's center of gravity. So the heavy rider has to adapt their posture by anteriorly tipping the pelvis and having a forward orientation of their torso in order to remain in balance with the horse. So factors which influence rider position are their height, both their limb length and their trunk length, their seat size, and the design, fit, and balance of the saddle, and the fit of the saddle, not only for the horse, but also for the rider. We performed a pilot study which comprised 34 horse-rider combinations, and a variety of different assessors were asked to determine whether or not the rider was too big for the saddle. And of these 34 horse-rider combinations, the seat of the rider was too large for the saddle in 41% of horses, as depicted in this picture. We performed a study of 150 horse-rider combinations. And I should comment here that I'm referring to a number of different studies And all of these studies will be available, or the citations of these studies will be available to you via the World Horse Welfare website. The seat of the rider was too large for the saddle in 45% of these 150 horses. 57% of the riders sat on the back third of the saddle rather than in the middle of the saddle. The potential reasons for this were either the saddle was too small relative either to the rider's leg length or to the size of their seat, or the saddle was the wrong shape for the rider, or the stirrup bars were in an inappropriate position for that rider's size, or the rider had an inherently poor position, or obviously it could be a combination of factors. The effect of where in the saddle the rider is sitting is potentially compounded if the rider is out of balance with the horse, so is not in complete synchrony with the movement of the horse. And of our 150 horse rider combinations, 54% of the riders were deemed to be out of balance by a British Horse Society instructor. The saddle seat tipped backwards in 21% of the saddles, and this is inclined to place the rider in a chair seat position, making it very difficult for them to maintain balance with the horse. The saddle moved excessively during ridden exercise, either bouncing up and down, that is dorsoventral movement, in 53% of the horses, or oscillating abnormally from side to side, seen in 58% of horses, or the saddle persistently slipping to one side, as we see in the image on the right, when the saddle is slipping to the left side. This was observed in 45% of the horses. We have to bear in mind that force equals mass, i.e. the weight of the rider, times acceleration. So the weight of the rider has a direct effect on the forces exerted on the horse's back via the saddle. And this is why I believe that the balance of the rider, the alignment of their shoulder, hip, and heel, and their ability to sit straight are of vital importance. And this is particularly important with respect to alignment of the rider's mass and the horse's center of gravity. So if the rider is very tall, as we see in the example here, relative to the size of the saddle, this results in the rider sitting on the back of the saddle and their shoulder, hip, and heel not being in alignment, making it more difficult for them to adjust their body weight to be aligned with the horse's center of gravity. So what are the consequences of the rider sitting on the caudal half of the saddle? We evaluated this by objective measurement of the forces underneath the saddle with the use of a pliance pressure mat. And here we have the results of the pressure according to the area under the saddle. The black squares represent the very heavy rider, the white squares represent the heavy rider, the black circles relate to the moderate weight rider, and the white circles represent the lightweight rider. First of all, we looked at the left-right symmetry of pressures at both walk and trot. And these are highlighted by the yellow boxes. And we can see that the average left-right pressures are pretty symmetrical for all the riders. We then look at the pressure distribution on the front half of the saddle versus the back half of the saddle. And we can see for the very heavy rider that there are substantially higher forces under the back of the saddle compared with the front of the saddle at the walk. There are slightly higher pressures underneath the back of the saddle compared with the front of the saddle for the other riders, but these are not statistically significantly different. When we look at the trot on the right-hand side and compare the forces under the front half of the saddle and the back half of the saddle, we see at the trot, the forces under the front half of the saddle are significantly higher compared with the back half of the saddle for the lightweight, moderate, and heavy riders, whereas for the very heavy rider, the pressure distribution under the front and the back of the saddle remains fairly similar. So, what consequences are there for this? In our study of 148 horses, which were assessed both in hand and ridden, we found that there was a positive association between riders sitting on the caudal 1/3 of the saddle and the ridden horse pain ethogram score. And I think this has to be borne in mind. It's very important that weight distribution is through the central part of the saddle, not through the back third of the saddle. There are consequences for back muscle function with respect to how the weight is distributed. We have previously shown that there are measurable increases in the width of the horse's back during ridden exercise. So if we use a flexible curved ruler to measure the width of the horse's back at 3 predetermined anatomical locations, the 8th, 13th, and 18th thoracic vertebrae, and we compare those dimensions at 3 and 15 centimeters below the top of the horse's back, we have shown that horses which are working correctly on the bit in a correctly fitting saddle show an increase in those back dimensions during that 30-minute work period. In our rider weight study, we demonstrated that if a rider whose body weight was at least 16% of the horse's body weight sat on the back of the saddle rather than the middle, there was actually a reduction in the thoracic dimensions during a 30 minutes work period. And this is demonstrated by these figures. For both the light and the moderate weight riders, we saw increases in back dimensions of 1.2 centimeters and 0.4 centimeters respectively, whereas for the heavy and very heavy riders, we saw reductions of back dimensions of -1 and -0.7 centimeters respectively. And these differences were statistically significantly different. Now you will see that with a very heavy rider, the back dimension reductions were less than for the heavy rider. And that was probably because the time to abandonment of the tests for the very heavy rider were much earlier on in the test, 8 minutes versus 16 minutes for the heavy rider. We believe that this failure for the back muscles to expand during ridden exercise has potential deleterious consequences for long-term development of the muscles and may actually result in atrophy or shrinkage of the long back muscle, the longissimus dorsi muscle in the thoracic region, and as a consequence of that, altered function of the thoracolumbosacral region. Now, this study clearly had some limitations because the effect of rider size is a multifactorial issue. We have to consider the horse, its height, weight, body condition score, conformation, fitness, and soundness. The rider, not only their weight, but their fitness, their skill, their ability to ride symmetrically, their balance, their ability to control their postures, and pre-existing health issues. The type of work that the horse does, its intensity, the duration of the work, the footing of the surface, and the terrain over which the horse is being worked. And also the saddle, the total load-bearing area, the fit and suitability for both the horse and the rider. But I believe that there are important take-home messages. These studies do not mean that larger riders should not ride, but they suggest that if large riders do so, they should ride a horse of appropriate size and fitness with a saddle that is correctly fitted for both the horse and the rider. With some riders, it may be possible to alter the rider's position by using a saddle which is better suited to their size and which also fits the horse. But we have to bear in mind that the saddle tree should not extend beyond the 18th thoracic vertebra. And therefore, with some horse rider combinations, it may be impossible to have a saddle which fits both the horse and the rider. We need to ask the question, does the combination look right? And if the answer is no, then that's probably the correct answer. I believe that horses are trying to communicate with us. We just have to learn how to listen to the horses. We need to learn how to observe more closely and understand that behavioral abnormalities usually reflect pain. We have a responsibility of care to the horses which we ride. I would like to conclude by acknowledging the many bodies that have provided financial support to the rider weight study, and also World Horse Welfare, who have supported my group financially for most of the studies that I've described to you. I also wish to thank all the owners who provided horses for the studies and all the riders as well, and the professional colleagues and collaborators. This is not a job that can be done by a single person. And lastly, before we have question and answers, I would like to draw your attention to a 12-part online course about how to recognize the 24 behaviors indicating pain in the ridden horse. This is a purpose-designed course available via Equitopia, which is in 12 parts and has interactive quizzes. For those of you watching tonight, there is a 30% discount available on the course until the middle of December using this login, WHW Ethogram 2020. Thank you very much for your attention, and I'd be delighted, together with Tony Tyler, to try and answer any questions that you have.
Sue, thank you so much. Blimey, that 40 minutes, 45 minutes, and just rich in content and so much to discuss. And questions are coming at us thick and fast. So what I'll do now is I'm just going to share my screen once more. Once I get that up, and just before I introduce Tony, I want to just ask another poll question. So the first question we asked was about you or us individually. The second question is just thinking of those around us. Do you think that other riders can recognise when a horse might be in pain? And here we've got a series of responses from yes, I think most riders can, down to no, I think most riders would not notice subtle changes. So whilst you're going to answer that, I'm going to hopefully There we go. I'm going to introduce Tony, who some of you joined us for our earlier webinar earlier in the summer. But Tony is Deputy Chief Executive of World Horse Welfare and has been with the charity longer than me. But obviously I'm young, so that's not very long. But Tony has got a lifetime of experience in the equitation and equine world, and has ridden and has coached, like Sue, to a high level. Tony more recently seems to be taking to running on 2 feet rather than on 4, and therefore is very keen to keep his rider weight spot on. So we're delighted that Tony, who's, as I say, oversees our UK work and therefore has first-hand experience of what we do in terms of the charity. So that is grand. Let us then have a look at the poll answers, if that's possible. Here we go. So interestingly, so this is shifted considerably down. So very few saying yes, a third saying possibly, and a third saying sometimes with the others. So that is interesting. And again, I'm sure Tony and Sue might pick up on that during the Q&A, which we're going to get into now. Thank you so much for all these questions. We will get through as many as we can. First one, Sue, how does spooking equate to being a pain indicator?
Well, we know it's a pain indicator in that we observe if we take away the pain, the horses immediately stop spooking. I think it's just one of those behaviours that is a manifestation of something not being right. Now, obviously, if the horse sees a paper bag floating about in the bushes, that's reasonable. The horse can spook at that. That's not what we're talking about. It's when the horse is seeing imaginary ghosts in the arena that we're talking about. A horse shouldn't repeatedly spook at nothing.
Yeah.
There's no reason to spook. There has to be a reason why it's doing so.
Absolutely, thank you. So another one for you. Why is the bit being pulled to one side an indicator of pain in the horse, please? Surely that's a rider.
Shown that many lame horses themselves take an uneven rein tension. So the rider, when I take the history, may say, when I ask them, do you have an even contact in both hands? And they say, no, my horse leans on the left rein. I get arm ache in my left arm. We know that if we take away lameness, particularly hind limb lameness, the horse will suddenly take an even contact on both hands. So we know that this is often induced by the horse. They have adapted their way of moving in some way such that they lean on more on one side of the bit than the other. Now you might say, why are they inflicting that discomfort on themselves? And I can't really answer that. All I can say is that by removing the pain causing lameness, they will take a more even rein contact. Unless, of course, they've got a crack in the corner of their mouth, which is why the horse is taking an uneven contact. So we have to look in the mouth as well to make sure there are no obvious oral problems.
And I can certainly vouch for that with some of the horses that we work on at the World Horse Welfare Yards, because obviously we see all sorts of different horses coming into the yards. And I know that with some of our riders, when they express the feeling that the horse is picking up the contact poorly on one side, that has been due to a lameness issue.
Absolutely. Question on Facebook, Sue. Do you think if a horse is painful in a certain area, then it will exhibit certain pain responses?
No, unfortunately, it's not that simple. Different horses respond differently to pain. So you can have two horses with exactly the same sources of pain, and they can exhibit a completely different spectrum of behaviours. So one may have its ears flat back and not want to go and switch its tail repeatedly. The other horse may gallop off in an uncontrollable way, have its ears forward, but be hurried all the time, spontaneously change legs in canter. So the behaviours exhibited are very much horse related rather than source of pain related.
Absolutely, thank you. A question from Alice, and Sue, I'll come to you first. I'm sure Tony will have a comment on this. If a horse exhibits these signs during schooling higher intensity work, but not at all during lower level work, as hacking, would the horse still be classified as lame?
I would say yes, because obviously when you're hacking, you are being much less demanding from a biomechanical perspective. So the horse may be comfortable under those circumstances and be perfectly acceptably comfortable under those circumstances. But the biomechanical demands of schooling, going in circles continuously, asking for increased hind limb engagement and impulsion, if that creates pain and lameness, that is lameness. But then you can make a judgment. You either investigate further and identify the underlying cause and treat it, or you say, okay, well, I can't afford to do that, for example. Maybe I will just hack the horse because the horse is comfortable under those circumstances. I'm not saying that we shouldn't be riding horses by any stretch of the imagination, and I'm not even saying we shouldn't ride lame horses, but I think we have a responsibility to decide under what circumstances the horse is or is not lame.
Yes. And Tony, I assume from a World Horse Welfare perspective, we're constantly wanting to try to turn out as many ridden horses as possible, but that's not always possible, is it?
No, absolutely not. And we do find that many of our horses, sadly, do not cope with a level of ridden work. And I think, agreeing with Sue's comments there, that some horses can be quite comfortable just hacking around, not being asked to work in a more collected shape and to go forward strongly. But as you build that level of energy up, just as if you were to ask a person to pick up a greater weight than they could physically cope with, sometimes then muscular pain will come in.
Brilliant. There's a few questions. Firstly, around rider experience. Does that impact, can better riding mask pain, Sue?
That's a very good question. We have done a study based on 40 horses, which were ridden by the normal rider and by an experienced professional rider. In the majority of horses, the experienced professional rider was more skilled than the normal rider. And we demonstrated that although the more experienced rider, the more skilled rider, could improve the way in which the horses worked, so their gait quality scores went up, she could not disguise behavioral aspects reflecting discomfort. So the behavior scores remained pretty much the same. Now, some of the behaviors changed. For example, there would be horses that with the normal rider had the front of the head in front of the vertical position more than 30 degrees for more than 10 seconds. But with the more skilled rider, the front of the head was behind the vertical position for more than 10 seconds, for more than 10 degrees. So the behaviors may change, but you cannot mask the behavioral signs of pain. The signs may change, but the total scores will remain pretty much the same, despite an apparent improvement in the gait quality.
There's quite a few questions around saddle fit. And Sue, one here, may I ask if there's an easy technique to check that my saddle does not extend beyond the 18th vertebra?
Well, yes, that's a minor issue in terms of problems with saddle fit. Having tight tree points is a far bigger issue. But in order to determine where the 18th thoracic vertebra is, what you need to do is feel the last rib, which slopes from front to back. So you can run your hands up firmly along the back side of the last rib. And when it reaches the vertebral column, that will be the level of the 18th thoracic vertebra. But as I said, having an excessively long saddle is a relatively uncommon problem.
Yeah.
A much, much more common problem is having a saddle which has tight tree points.
And I think, Sue, would you agree that that does emphasise the fact as to how important it is to have your saddle checked regularly? It's something that we do a lot at the farms because our horses change shape a lot. Some of them will have muscular issues when they first come to us. And so we regularly get an experienced saddler to come out and check those saddles.
Absolutely. I think that's very critical because we know that horses can have measurable changes in their back dimensions within a 2-month period. We did a long-term study over a period of a year when we looked at about 120 horses every 2 months over the year, and we could see measurable changes. Some of those changes were seasonal. Some of those changes were related to time off for a musculoskeletal problem when the muscle dimensions tended to decrease. Other times, if you change from an ill-fitting saddle to a better-fitting saddle, you would within 2 months see a measurable increase in the back muscle dimensions. So it is hugely important. And I would say every 3 months would be the ideal interval, particularly in young horses.
Interesting you mentioned young horses there, Stu. Quite a few questions around, we've talked about rider experience, but what about horse experience? And does a young horse which has no core strength, and does the age and experience of a horse make it harder to assess?
With respect to the ridden horse pain ethogram, no, I don't think it is. Horses, a normal horse should learn quickly. It might not perform a movement ideally to begin with, and its gait may be a little bit wobbly, but it doesn't show signs of musculoskeletal pain. It may be slightly different, performing a movement on the left rein versus the right rein, but it doesn't show behavioral problems reflecting pain. A young horse should be able to canter easily on the left and right reins. It's not normal if the horse finds it difficult to get into canter on one rein versus the other.
Brilliant, thank you. So, question for Tony, a Facebook question, slightly later. Riding horses that are 2 and 3 years old, does that damage their development?
Well, I think that you have to be extremely careful with a younger horse because their bone formation is not complete at that age. And there in particular, and again, I'm sure Sue will have a comment on this, that the weight of the rider is absolutely critical. Personally, then I would prefer with a normal ridden horse to wait until they're that little bit older. But obviously the race horses are ridden at a younger age. And there has been some research done, I believe, to show that there isn't a great amount of damage to the race horses. But again, I'm sure Sue would know more on that than I would.
I think young race horses have a completely different spectrum of injuries compared with the mature horses. And they do have a very high prevalence of stress-related bone injury, which is directly related to repetitive strain injury of immature bone. And some of that can have long-lasting effects. I think that there are some potential benefits of early training, but they have to be weighed up against the downsides as well. And for a potential sports horse, I would suggest that 3 is the appropriate age rather than 2.
Absolutely. It's a question from Jean. How does riding style or aggressive versus non-aggressive riding behaviour impact on pain indicators?
Well, I don't think it does. I think the aggressive rider, the very strong rider, can make the horse do things, and it can move better, but it will not influence the horse's behaviour. The horse's behaviour may change, but if it's got underlying pain, it will still show signs based on the ridden horse pain ethogram of pain.
And I think you answered this in the presentation, Sue, but Rachel's asked, did you look at different riders and saddles bit combinations on the same horse?
No, we haven't as yet done that, although on a clinical basis, I will frequently change the saddle if the saddle doesn't fit the horse. And I think that's a crucial part of investigating a ridden horse. So I have to determine if the saddle fits the horse. And if the saddle doesn't fit the horse appropriately, then I will change the saddle to a better fitting saddle and expect to see probably an improvement in gait and an improvement in behavior. However, in some horses, it will make lameness become more obvious because with the ill-fitting saddle, the horse will be restricting its range of motion of the back and therefore protecting its limbs. You put on a better fitting saddle, the horse feels more comfortable in its back, it moves more freely through its back and doesn't protect the limbs to such an extent, and now underlying lameness becomes more obvious. So I think it is crucial that we assess everything.
Absolutely. Interesting observation from someone that in 3-day eventing, they still do straight line trot ups to assess ability to go on a show jumping phase, but we'll leave. Can this be translated? Interesting question here, Sue. Can this be translated to driven horses in terms of weight, I'm assuming?
With respect to behaviour, I mean, I do see some driven horses that I investigate, and I think they can show very similar signs of behavioural abnormalities if they've got underlying pain. With respect to how much they're pulling effectively, I can't answer that question.
No.
I can certainly say that the driven horse will show very similar behavioural abnormalities if they have underlying musculoskeletal discomfort as compared with the ridden horse. But we haven't actually tested it in a scientific way, but that will go my clinical observations.
Brilliant. A question for you and then one for Tony. Rider weight. Do these percentages refer to solely the rider weight, or do they include the tack?
The percentages I gave you there were related to the rider weight. We did measure the tack weight. Obviously, that was the same for each horse because they used the same tack all the time throughout the study. If you look at the original paper, which is open access, so you will have available to you via the World Horse Welfare website, you will find in that the total weights are also included.
Brilliant. Tony, the question, I mean, obviously Sue will comment, I know, but what about overweight horses in terms of rider weight? Would that exacerbate it, or would they be stronger to be able to take greater weight?
For me, it would absolutely exacerbate it, because if the horse is carrying additional weight in addition to the rider, that can't be a good thing. And in fact, in a couple of talks that I've given, there have been individuals that have suggested to get the percentages closer to what has been suggested, they would just put extra weight on their horse, and that would be absolutely the wrong thing to do.
Yeah, I would completely endorse that. Absolutely 100%.
So would you prefer a treed or a treeless saddle?
The important thing to me is that the saddle fits the horse appropriately. Some horses seem to prefer a treeless saddle, whereas other horses prefer a conventional saddle. The key factor is that the saddle must fit both the horse and the rider.
Brilliant, thank you. Much like the pain algorithm, is there a rider weight height algorithm they've asked that could be used?
No, there isn't at the moment. That is something longer term that we are hoping that we'll be able to develop. But as I pointed out, the issue of rider size, and I use that term size, is very important. I don't think it's just a weight issue. I think it's a size issue overall. The issue is multifactorial because of the so many factors that come into play. So you can have a very big rider who rides beautifully in balance, who's a very skilled rider, and they will have a less adverse effect than a smaller rider who is completely out of balance. So it's not a simple, straightforward, black and white answer.
Yeah. Chris has made the comment, just going back to the previous, there's a real challenge of how we persuade people that an overweight horse should actually carry less rider weight, not more. Sue, there's quite a few questions around interaction with the veterinary profession, and vets with, especially the obviously the pain ethograms. But so, Jennifer's asked here, are there training opportunities for non-veterinary professionals to use the ethogram?
Well, that's why I've drawn your attention to the Equitopia course. The Equitopia course is developed by me in association with Equitopia, and it is designed to be relevant to somebody of any background. Be you be an owner, a rider, a trainer, a veterinarian, it's there for anybody. I do think it's important to undergo training for accurate application of the ethogram. We have shown in several different studies that with training, people's ability to apply the ethogram improves. But this 12-part course with interactive quizzes gives you the opportunity to test yourself and your ability to learn. And then you have to go out and practice. It's like any clinical skill, you need practice in the ability to apply that skill. but anybody can learn it.
Tony, will Well Towards Welfare be looking at that course and potentially making use of it?
I think we should, yes. Yeah, that would be good.
Again, I've got a few questions. I think we've answered this, Sue. Is there a correlation between the number of behaviours and the severity of pain?
I don't think it's very easy to actually quantify the severity of pain, because you have many horses that, for example, will show a low-grade lameness on several limbs. So they don't look very lame, but in fact, they've got lameness on several limbs. So the cumulative pain is probably quite high. But if you were just to say, grade the lameness, I may say the horse is only grade 2 out of 8 lame on its left hind limb, because it's being balanced out by the fact that he's also lame on the right hind limb and the left forelimb.
Yeah.
Lameness grade is potentially misleading, and we don't have other ways really of quantifying pain. And different horses will have different pain thresholds, just like different people have different pain thresholds.
Yeah. We should be finishing. I've got a series of about 50 questions here, so we're going to go on a little bit longer, but I'm afraid we won't be able to get all 50. Can oral pain manifest as lameness, Sue?
I think that occasionally it can, but it is only occasionally.
Absolutely. Is there a difference to consider between horses and ponies in terms of the comfortable weight bearing ability? So if we're looking at a percentage, would it sort of be similar percentages regardless of the size of the horse?
I think so, yes.
Sorry, Tony.
Sorry. I just wondered, Sue, what are your views on the different pony breeds with that? Because they do, with some of the fell ponies and things like that, for example, we often get the argument that they were bred to carry heavier weights than farmers, etc.
I don't think there's any evidence to support that statement. I mean, they do carry down the hillsides stags that have been killed, but they're only walking. We're not asking them to be athletic individuals. And I think you have to think about this in terms of, do you expect the animal to be an athletic individual, i.e. walk, trot, canter, jump, or do you just want it to walk? So what is acceptable for walk is very different to what might be acceptable for more demanding athletic activity.
Excellent. We had a first tonight. I've never had a panelist asking another panelist a question. There you go. How can you tell the difference? Can you tell the difference, Sue, between past trauma and current subtle pain?
I think this probably relates to the question, do horses remember pain? And I don't believe they do. And the reason I don't believe they do is because if I perform nerve blocks, so I desensitize a limb on a temporary basis, I will see immediate improvement in the horse's behavior if the pain has been taken away. So they don't have remembered pain. That behavior improves immediately. Now, you can have horses which have had very long-term problems. The owner may say, this horse has never wanted to canter on the left rein since I first bought the horse, and they first bought the horse 3 years ago. Those horses are more difficult to completely abolish the pain using nerve block techniques, but you will still see a marked improvement in both their gait and in their behaviors if you successfully identify the sources of pain and remove them using nerve blocks.
Yeah, okay. So teeth grinding, can that be a pain indicator? A few people have asked that.
Absolutely. We did not include teeth grinding in the initial development of the Ridden Horse Pain Ethogram because we were using video recordings. And with video recordings, you obviously can't necessarily reliably record all sounds made by the horse when they're on the far end of the arena. But I strongly believe that tooth grinding, disproportionate sweating relative to the environmental temperature and the work intensity, an abnormally elevated respiratory rate relative to environmental temperature and work intensity and fitness can all reflect the presence of discomfort. And when we take away the pain, those signs either go away completely or reduce substantially.
Brilliant. So I'm sure you'll have a view on this, but Tony, I'll ask a question from David. Are the demands of some horse sports, such as ridden dressage, including tight circles, a cause of pain behaviours? And if so, should movements potentially be modified to reduce the number of pain behaviours?
I think they can be if the horse is not ready for those movements. And I think it all boils down to has the horse been properly prepared? My personal view is that we see a lot of young horses being asked to work very hard at a very young age. And so in those cases, then for me, actually, some of those movements could be very demanding.
My feeling is that we shouldn't modify the tests, but we should modify our expectations of what a horse is ready to do, which reflects what Tony is saying. The horse must be appropriately produced and develop the right musculoskeletal strength and coordination in order to carry out those movements. Because a clinically normal horse should be able to perform a 10-meter diameter circle easily without showing any signs of discomfort. But it has to be properly trained such that it is appropriately balanced and has the right musculoskeletal strength and coordination to do it.
Thank you. So, Tony, if I suspect lameness in my horse, is it better to start with a vet check, or should one try massage therapist or chiropractor first, or does it matter?
My personal view is if I thought there was lameness there, I would get a vet straight away, personally.
Sue?
I have to admit some bias, but in saying that, I also recognise that there are some limitations within the veterinary profession, in that as a vet going to vet school, you are taught how to identify obvious lameness. You get no training in terms of identifying subtle lameness, and certainly no training in the evaluation of the ridden horse. And there are some physiotherapists and chiropractors who come from a very strong equine background and are actually better at identifying low-grade gait abnormalities than many veterinarians. And they therefore may be able to confirm to you that there is a problem, and they may be able to advise you about a specialist veterinarian who would be better suited to investigate the horse rather than the GP equine vet. I always use the parallel. If you are a human athlete, you go to a sports medicine expert. You don't go to your local GP when you're feeling that you're not right. And I think the same should apply to our equine athletes. The GP equine vet may not have the adequate training and experience to investigate these problems, whereas a more specialist equine vet may be better able to do so.
Yeah, if I can just add to that, I guess that we are extremely lucky, obviously, at the World Horse Welfare Farms with the vets that we use. And we also have a team of specialists. Each of the farms do use equine physiotherapists as well, so that both the vet and the physio will work together to get a diagnosis.
Absolutely, and that teamwork between the farrier, the physio, the saddler is at the heart of what the equine of World Horse Welfare's rehabilitation process is all about, isn't it? And that effectively, Sue, that's what you're saying, that working together, because
well, I mean, I think it's hugely important that we have a team approach, both from a diagnostic perspective and from a management perspective. And I use the word management deliberately, because I think we have to recognise that some of these problems cannot necessarily be cured. We can manage the horse to be able to perform in a much more comfortable way. But that may require ongoing management. It's not just a single treatment and that's it. We have to continue to do everything to make the horse comfortable. And that means paying attention to the tack fit, the rider position and balance and their fitness, the footing, as well as regular muscular treatment from the physiotherapist, etc., and appropriate trimming and shoeing from the farrier. So it's all a big team approach to maintaining optimal performance and optimal comfort for the horse.
Brilliant. Sue and Tony, thank you. We have got a stack load of more questions. I'm very sorry that we can't get through any more, but we've gone well over time. But thank you for contributing so many brilliant questions, and I apologise I haven't been able to get through more. Tony, obviously Sue's given us a wonderful couple of presentations on two really interesting topics, and we've had a very sort of wide-ranging discussion. What are your final thoughts, having heard all of that?
But I think it's been a great talk because it makes people aware. So often, I mean, I not only work for World Horse Welfare, but I have a lot of involvement with the local horse community, and I'm lucky enough to still ride a number of horses every now and then. And I think that just getting people to analyse a little bit more what their horses are doing. It's not necessarily just being naughty. We hear that all the time. Oh, he's a bit of a naughty horse, or he's a bit of a character. Why is the horse doing that? And that for me is the key take-home message.
Brilliant. Thanks, Tony. Sue?
Just look at your horse and observe it under all circumstances. So, for example, the horse that tries to bite you when it's being tacked up, it's probably a reflection that this horse is anticipating discomfort either from the saddle or from the ongoing riding experience it's going to endure. So we need to look at the horse under all circumstances and then compute in our brains what those observations might mean. Continually observe.
Brilliant. Listen, thank you so much. I should have said earlier, we've obviously had many webinars and there's been lots of really sort of great support for them. Tonight we've had people from, and this morning we've had people from New Zealand, Germany, Estonia, Lithuania, Canada, Israel, Slovenia, Czech Republic, Finland, Ireland, and doubtless many more. So thank you for wherever you are for joining us for what has been a fascinating discussion. We've scratched the surface of it as ever, but you know, hopefully those take-home messages from Tony and Sue will really sort of resonate with people. And I hope that really helps you in looking after your horses in terms of getting those key messages across, especially around saddle fit and around observing and in terms of improving our horsemanship and how we can look after our horses. Because as Sue says, it is about improving our horsemanship, which is what this has been all about. So thank you very much to Sue and Tony once again. Thank you for joining us. Please do join us again in a fortnight for our next Wednesday webinar. In between now and then, wherever you are, take great care of yourselves and have a great evening or morning.